Hi friends, welcome to Dr. Ram's Medical Coding Academy. Today we are going to talk about the changes in the EM section of the CPT Manual 2025. In our previous video, I have discussed about the code changes for this entire CPT book, spanning across all these sections. But today we are going to specifically talk about the code changes in the EM section alone. I hope you are aware that there has been a major change in the medical decision-making component of this E&M service. But this year, we are continuing to use the same kind of MDM which you have seen last year. But then, let's talk about the number of code changes here. There are 70 new codes being added, and 3 codes have been deleted, and no code has been revised for 2025 E&M section. If you wonder where these changes are not seen in any other heading of this E&M chapter, but the changes are exclusively in the telehealth portion. We have witnessed that there has been a significant leap, especially in the telehealth and telemedicine portion of this healthcare service post-COVID-19. So the American Medical Association has considered the usage of 17 new codes for the telehealth services. When we talk about the telehealth services, we understand that there must be a communication that needs to be established between the healthcare provider, the doctor, and the patient. We can divide these telehealth services into two as synchronous and asynchronous. You must understand what's the core word meaning of synchronous. So you can break this word into two as SYN syn plus chrono. The prefix syn refers to with or together, and chrono means time. A synchronous service refers to a real-time service. An asynchronous service is one which is not real-time. Let me explain the CPT code definition for both of these services along with the respective codes. We see that the CPT code descriptors for synchronous visit states synchronous audio-video visit for the evaluation and management of a patient which requires a medically appropriate history and/or examination and a complexity of either straightforward, low or moderate or high. We also need to consider the time factor while reporting these codes. You know very well that an E&M code can be selected based on the extent of medical decision making or the time that the physician spends with the patient, and of course a non-face-to-face time as well. So here we can choose synchronous audio-video visit services based on the level of MDM and the time here. Let's quickly look at the slide here. The CPT code 98000 has a straightforward medical decision making with a total time of 15 minutes. 98001 has a low complexity MDM with 30 minutes. CPT code 98002 with a moderate complexity of MDM has 45 minutes. And finally, the CPT code 98003, which is of high complexity, entails 60 minutes. We see that these codes are meant for the new patients. You are aware that a new patient is one who has not received any professional health service for the past 3 years of the same specialty or subspecialty. Next, let's see the established patient codes for the synchronous audio-video visits. According to the medical decision making, the CPT code 98004, which is of straightforward complexity, has 10 minutes. 98005 has low complexity MDM with 20 minutes. 98006 with a moderate level of medical decision making has 30 minutes. And code 98007, which is of high complexity, has 40 minutes for the established patient. Now let's see the audio-only component of the synchronous visit telehealth services. This set of codes differ only on the video element because the code descriptor says synchronous audio-only visit for the evaluation and management of a patient which requires a medically appropriate history and or examination and medical decision making of straightforward low or moderate or high complexity. Now, when we look at the audio-only portion of the synchronous visit, we can classify that into new and established patients as well based on the extent of medical decision making and the time the physician has spent. For new patients, we can report code 98008, which is of straightforward complexity with a time of 15 minutes. 98009 has low complexity MDM with 30 minutes. 98010 has a moderate medical decision making complexity with a time of 45 minutes, and code 98011 has a high complexity MDM with a total 60 minutes. If the patient is going to be an established patient, then we can report 98012 with a medical decision making of straightforward complexity and the time is 10 minutes. Code 98013, which is of a low level of medical decision making with 20 minutes. Code 98014 with a moderate level of medical decision making as 30 minutes. And code 98015 with a high complexity MDM as 40 minutes. So far, we have seen the synchronous visit services. Now let us have a look at the asynchronous visit, which is represented by the new CPT code 98016. The code 98016 has a descriptor which states as a brief communication technology-based service by a physician or a qualified healthcare provider to an established patient not originating from the previous 7-day E&M service nor leading to an urgent service within the next 24 hours for 5 to 10 minutes of discussion. With this, we understand that from the CPT code 98016, we can report it only if it is an established patient, meaning the patient who has been known to the physician and who has taken the treatment within the past 3 years. This asynchronous service shall not be related to any other E&M service which has been done within the previous 7 days, and the patient shall not visit the doctor immediately within 24 hours or the soonest available appointment, because that is considered as an inherent part of the pre-E&M service of the next E&M visit. Moreover, this is like a virtual check-in which is being done by a doctor for around 5 to 10 minutes. So we see that these 17 new codes are being added. Now let's quickly look at the deleted codes. The deleted codes are from the telephone services. Previously, if you see that the E&M section, the CPT manual, contained the telephone visit services for physicians and other qualified healthcare providers in the EM section. And if it is going to be a non-physician provider, these services are represented in the medicine section. What has happened is the editorial panel has removed the telephone visits this year. If you see the reason as to why this has been removed, now look at the new codes. When you look at the new codes, especially the synchronous audio-only service, then that's similar to a telephone service. Since we have a real-time audio-only component of the telehealth service, then we can do away with the telephone services. So you see that the codes 99441, 99442, and 99443 have been deleted, effective 2025 January 1st. If you see the application of these synchronous and asynchronous services, this is going to be of immense beneficial to patients who are there in remote or the rural areas or in places where there is a dearth of healthcare providers. A doctor in the emergency department can avail the valuable synchronous audio-video service from a specialist who can guide this emergency physician. Same way, a primary care provider can seek the opinion of an ophthalmologist by sending the retinal images of a patient who is suffering from a diabetic retinopathy. Now, patients can also upload images or their photos and send it right away to a dermatologist using the synchronous telehealth services. Well, these are the changes for the E&M section this year. If you are first time and watching my YouTube videos, then I would like to give a very quick introduction of my own self. I'm basically a homeopathic doctor who has done B.Sc Psychology, MSc Psychotherapy and a diploma in Bach Remedies. Then I did my BHMS and then MD. After that, I entered this field of medical coding, wherein I cleared 33 certifications offered by the AAPC. I stood the All India topper of AAPC and have also acted as a speaker of AAPC. I am currently the director of Dr. Ram's Medical Coding Academy in Chennai. If you are a person who is interested to join this industry of medical coding, you can very well reach out to us. You can also avail the training offered by us. At Dr. Ram's Academy, we provide training at two levels. Level 1 is for freshers and level 2 is for students who go for the CPT examination. So if you have any queries, you can post in the comment section. And if you want a personal training from me, you can please contact the given number here. I have published a previous video on the code changes for this entire CPT book. If you have not watched that, I am placing a link there. Please click on that and you can see that video. I will be creating new videos on the other sections as well. Please like and share our video and subscribe to our YouTube channel. These videos will be very helpful for students who are going to take up medical coding as a future career. I will see you in the next video. Thank you.